The reality is Victoria is different, city by city, town by town. So to have the commissioners here for 2 days with us up at the hospital, having a look through the facility, having a round table with key community members, I think provided the platform for some great understanding about certainly this rural community, its needs and the opportunities, but also the challenges.
It's not true that what works in the city will work in the country. So if systems are designed around what would work in Melbourne or in a regional centre, then those same systems may not work in rural areas.
It was important for me to give evidence today at the Commission to give back to society and try and help Victoria build a better system.
To build a new mental health system. Our current one is so broken. We are losing so many people to suicide. If it was a road toll, something would have been done a long time ago. But we're losing generations of people.
Around about a third of our population live in rural and regional areas. So we should have a voice in how our mental health system works.
I hope the Commission ultimately can provide the recommendations for a system moving forward which helps patients and their families and their carers navigate the support they need, navigate the help they need.
Suicide, now there are people out there really struggling. Suicide, if they don't do something, is going to be very prevalent, I can see.
I hope that there's, a pathway for future action. So that services are accessible, people's capacity is built, stigma is reduced, all those things to allow people to live more effective and fulfilling lives.
Particularly for mental health, in my experience, and share my case, my experience with it, not only to help the Commission get evidence to build a better system, help build a better system, but to help others in the community that may or may not be struggling with their mental health issues. And if I can help one person, hey, that's a win.